Hi there. We're now going to do our musculoskeletal assessment. First thing that we're going to do is check all of her joints from head to toe. We're going to inspect, palpate, and then we'll check range of motion. So first thing that we're going to do is check the temporomandibular joint. We're going to look at it, see if there's any swelling, any redness. Does the patient have any pain? Is the patient grimacing? And it looks normal. So we're going to put our hands on each side of the joint. Okay, go ahead and open your mouth and close for me. Okay, and there is no clicking, anything abnormal when the patient opens her mouth. Next thing that we're going to do is we're going to check her C-spine or cervical spine. So we're going to inspect it. I'm going to have you just look straight ahead for me. I'm going to inspect it. C-spine is straight, no abnormalities noted. With her neck, no inflammation, no nodules, no bumps. Skin is pink, warm, and dry. So next thing that we're going to do is we're going to palpate her spine. It feels normal and midline. We're also going to check her range of motion. So first thing I'm going to do is go ahead and put your chin to your chest. Put your chin to your chest. Good. Now I want you to look up at the sky. Can you look up at the sky? Look up with your eyes. No, look up. Look up to the ceiling. Good. Now look straight ahead. Good. Now can you look side to side? Good. Now what I want you to do is put your ear on this shoulder. Good. Now put your ear on that shoulder. Okay, good. The patient has good range of motion of her neck. Next thing that we'll do is we'll check the shoulders. It's a little hard to see with this shirt on, but we can pull it up. We can see if check out any bony articulations, if there any swelling of the joint. Her skin's pink, warm, and dry. No abnormalities. Her shoulders look straight. Okay, are symmetrical on each side. We're going to palpate next. So we'll palpate the shoulder joint, looking for any pain, any bumps, masses on each one. And then we can also check the range of motion. So we'll have the patient bring your arm up. Okay, can you bring it over? Good. Now we're going to go back around. Okay, and in front of you. Good. Good. Now can you go up? Go all the way back. Okay, now bring it down. All the way back. Good. Good. She has good range of motion in her shoulder. Next thing, we'll check her elbows. So we'll inspect the elbow. Look for any bony prominences, any swelling, bumps, redness, anything like that. And then we're going to palpate. So we're just going to feel the elbow, check for any pain. And you can always do this, always look at the joints bilaterally. You can look at them, make sure they're even, the same, equal. We'll check her range of motion now. So go ahead and put your arm out in front of you. Okay, bend your elbow up towards, okay, now back out. Okay, now flip your hand over. Good. Okay, and come in. Back out. Good. She has good range of motion of her elbow. Next thing that we'll check is the patient's wrists. We'll inspect her wrists. Wrists look normal, no bony abnormalities, no redness, no swelling. We'll palpate the wrist. Palpate for any cysts, bumps. Any pain? Turn it over. Wrist feels normal. Now we'll check her range of motion. Okay, so what I'm going to do is have you put your hand down like this and back up as far as you can go. Straight. And we're going to go side to side. Abduction, adduction. Very good. She's got normal range of motion of her wrist. Next thing that we will check is the patient's hand. So we'll look at not only the hand but the fingers as well. Checking for swelling, bony prominences, lumps, bumps, moles, scars, injuries. We can have the patient turn her hand over and check the other side of her hand. Okay, and that's normal. And then we'll palpate for any masses, lumps, bumps, cysts, abnormalities, and there's none noted. Now we'll check range of motion in the patient's hand. So we'll have the patient spread her fingers out, now back together, and hold your hand straight. Now instead of doing the wrist, we're going to do the fingers. Just put your fingers down. Very good. And up as far as you can do it. Good. Okay. She has good range of motion of her hand. Doing that, we can also check something called a Fallon's test. The way that we do that is we'll have the patient put your arms out and put the backs of your hands together, and we'll hold it for 60 seconds. If the patient has any burning or pain, a lot of times that can mean the patient has carpal tunnel syndrome. Another way to check for carpal tunnel syndrome is called the Tunnel sign, and you hold the patient's medial nerve, okay, push on it, and then percuss it, tap on it. If the patient has pain or burning, then that is a positive sign, and probably means the patient has carpal tunnel syndrome. Next thing that we're going to do is we're going to check the patient's hip. So I'm going to have her go ahead and lay down for me. Can't see your hip, but we would inspect the hip, check for pain or check for redness, swelling, anything abnormal. Her hips are even bilaterally, they're equal size. We would palpate the patient's hip, check for any bony prominences, abnormalities, pain, and then we're going to check the patient's range of motion. So first thing we're going to do is I'm going to lift your leg, okay? I'm going to have you lift this leg up. Good. Now put it back down. Okay, now we're going to do adduction. We're going to move the patient's leg out here. Check her hip. You can, if there's any clicking or anything like that you would hear, the patient would feel it. So adduction, abduction. All right. Good. And you can also turn the patient's leg out. Internal and external rotation. Tilt it back in. Very good. All right. And next, we'll evaluate the patient's knee. We'll inspect it first, checking for the usual, any swelling, abnormalities, anything shown, skin color, and then we can palpate the knee. When the patella is relaxed, you should be able to move it easily, a little bit side to side. Okay, and check for any kind of pain, masses, and there's nothing found. Okay, and then we can also, when we're checking the knee, you can check for something called a bulges sign, which checks for fluid in the knee. You can kind of push, kind of massage on the medial part of the patient's knee. We can push on the medial part of the patient's knee. Sometimes you can see the fluid kind of shift over to the outer aspect of the patient's leg. So if a patient does have fluid on her knee, then you will see that. Next thing is McMurray's test. And we can do that by, we'll bring the patient's foot up, kind kind of bend her knee. I'm going to leave your other knee straight. Bend this knee for me. No, bend. Good. Kind of dorsiflex the foot here. And kind of go backwards and see if there's any clicking of the hip, of the patient's hip and knee when you straighten it out. Okay. Next thing we'll do is we'll check the patient's ankle. So I'm going to have you sit back up for me. So we can get back in the camera. Go ahead and scoot back. Thank you. Just a little bit more. Keep scooting. Scoot, scoot, scoot. Perfect. Good. So we'll inspect the patient's ankle, check for swelling, redness, skin color, noticeable masses. Then we'll palpate. We'll palpate the ankle. Okay, checking for any bony prominences, masses, checking for pain. Is the patient grimacing? You know, what's her demeanor? We'll check range of motion. So I'm going to have you pull your toes back to your hip. Good. Now point your toes real big for me. Good. Now I'm going to have you curl your foot inward. Good. And now outward. Very good. Very good. Okay. Next thing, we'll check the foot. We'll inspect the foot. Looking for the usual redness, swelling, anything abnormal. You can look at both feet. Make sure they're equal in size. Excuse me. We'll palpate the patient's foot. Checking for any abnormalities, including the patient's toes as well. And then we will check range of motion of the patient's foot, which we kind of did that when we checked the ankle, but you can, have the patient kind of hold the patient's foot up, have her point your toes while holding your foot up. Point your toes. Point. That way. Now bring them up towards you. Good. Good. Okay. Next thing that we'll check is the patient's spine. So I'm going to have her stand up for me. We're going to check your spine, and I'm going to have you stand right in front of me, right here, and I'm going to have you look that way. I'm going to have you put your back to me. And of course she has her shirt on, but you have the patient look straight ahead, stand up straight and look straight ahead. Good. And you can visualize, inspect the spine. You can see if it's midline, if there's any curves, that might show scoliosis. But her spine is straight. Her hips are straight and equal. And then we'll palpate. So we can palpate this way. And then we can also have the patient bend over and touch your toes. Can you bend over and touch your knees? Good. And we'll check her spine. And we'll palpate for any abnormalities. And her spine is good and straight. Okay, good. You can stand back up for me. Good job. Next thing that we're going to do is, that's it. And then, of course, the muscle testing. The muscle testing, we can check, especially when we had her laying down and having her bend her legs up and move her own legs. You can see the muscles kind of tightening up, both places. There was no atrophy noted. She had a normal assessment. Everything looks good. Thank you.